So blepharoplasty is one of my favorite procedures to perform, and the reason is it's a slam dunk for my patients. It really improves their overall look, really makes people able to see better, get more light into their eyes, and also look a lot less tired. So there's two types of blepharoplasty. There's upper lid blepharoplasty and there's lower lid blepharoplasty. So I'll talk about upper lid first. It's the most common treatment. Most people come in when they feel like they really can't see their eye makeup, or they feel like their eyelids are sitting on top of their lashes and making their eyes feel really tired or fatigued at the end of the day. So this procedure, when you come in and we do the treatment to remove that redundant skin, you come in, we actually give the patient some medication, really get relaxed so that they don't feel stressed or worried, because it's a little nerve-wracking to think about someone working around your eye area. So we get people really nice and relaxed, and then we clean the skin. We mark the extra skin that we need to take and do measurements to make sure that it's perfect and very precise what we're removing. Often we'll take more off one side than the other because most people aren't completely symmetric. Once we get the marking done and get the patient really relaxed, we do a tiny little injection of lidocaine right at the corner of the eye to completely numb the skin so that it's a completely painless procedure. Once that happens, we actually use a little protective shield that we place under the eyelid, just kind of like a contact lens. And the reason we do that is to protect the eye. I actually do the surgical procedure with a laser. Many years ago when I first trained, I used a scalpel, but the laser is much more precise. It actually makes a 0.2 millimeter incision, and it also seals off blood vessels as we go. So there's a lot less bruising, bleeding, and swelling with the laser than there was when we did it with just the scalpel. So once we remove the skin with the laser, we will often take out a little bit of fat in the mid portion or the lateral portion of the eyelid if there's bulging fat pads there. And then we just do a nice little running stitch that just goes right into the crease of the eyelid. And then those stitches will stay in for about 1 week. We send the patient home with arnica, which is an herbal supplement to prevent bruising and swelling, an ice pack so that they can do ice 10 minutes every hour. We ask that patients sleep elevated because any swelling from the procedure needs to drain from the eyes down to the cheeks and then down to the neck. So the more they lay flat or the more they bend over or do strenuous lifting, the more that swelling is going to stay around. So those are the things that we recommend at home. We send them home with the appropriate things to cleanse with and Vaseline to keep on that suture line. And then once the stitches come out in a week, they may see a slight pink area right where that incision was made that usually fades completely into flesh color within just the next several weeks. So we get people back with before and after pictures, and that's when the wow really happens. Patients are really excited to see that really we've taken many, many years off of their appearance. So lower lid blepharoplasty is really reserved for those patients that come in and they have really a bulging fat pad under their eye. This tends to be very hereditary, and it tends to get worse with time as volume loss and support structure of the cheekbones gets lost a little bit. That fat pad tends to bulge out, and it makes people look really tired even when they're not. So it's a great procedure because we actually are able to do it in a scarless fashion. We have the patient come in, again, get them very nice and relaxed with some medicine. We call it I don't care juice, so that they can be nice and calm and not feel any pain or anxiety with the procedure. Then we do a little injection of lidocaine on the lower eyelid to numb both the skin and the fat pad there. We also put in a shield to protect the eye. And then we use a little retractor where we pull the eyelid down and we make an incision on the mucosal side of the eyelid. And once that incision is made, that little fat pocket just pops right out and we're able to pull it up and remove it with the laser. And I use the laser because, again, it's very precise. It makes a tiny little incision, and it also seals off blood vessels as we go. So there's much less bruising and swelling by using the laser device rather than just using a scalpel. That incision on the inside of the eyelid just heals all by itself. So the patient goes home, they really don't have to do anything except just re-wetting eye drops like Refresh eye drops just to help their eye feel soothed and calmed. Frequently, if we do upper and lower eyelid surgery together, we will send the patient home with even a little bit of an oral steroid, because there can be fairly significant swelling for the first 72 hours if we do the two procedures together, and that oral medication really calms it down. Once the swelling subsides, usually within 7 to 10 days, especially if we did the lower and the upper together, the patient just really will be thrilled with the results. That bulging fat pad will be completely gone, and they'll have a really smooth under eye area that just makes them look really refreshed and many years younger.